Welcome back to the Arise interview. I'm Charles Aniagolu. Now let's look more closely at the situation of the Afghan refugees, the many thousands who are trying to leave. You might have seen those images of chaos at Kabul airport here on Arise News. Well, Uganda has become the first African country to offer shelter to Afghans who are intending to leave the country. The Ugandan government has agreed to grant temporary asylum to 2,000 refugees. It's not quite clear what the arrangement is, but in the background is the fact that Uganda has traditionally been very generous to refugees. It hosts about 1.5 million of them, mainly from the Democratic Republic of Congo and South Sudan. Well, Professor Kilian Songwe is an international consultant who's worked in Uganda and is across this latest development, and he joins me now on the line from the US. Thank you very much indeed, Professor, for joining us. We've heard different things. From different sources. What do we know for sure about this offer from Uganda to host Afghan refugees?
Thank you for having me. As you just said earlier on, Uganda happens to be a very hospitable nation. And in terms of numbers of refugees that they currently host, yes, about 1.5 million. Uganda actually has done a phenomenal job in terms of hosting these refugees, in terms of the camps that they have, their dispersion across the country. And so another 2,000 refugees is if I may say, it's a drop in the bucket compared to what they currently have and the job that they've done in maintaining, managing the stakeholders, the partners in the countries, what they do to support the refugees, the water systems, the borehole systems, the sanitation, the hygiene that is across the camps. I think Uganda has done a phenomenal job to this point. And of course, we thank His Excellency Yoweri Museveni for continuing to offer his hands to refugees as they come into the country.
Well, let's just first of all define who these refugees are, because in terms of the category of Afghan refugees who will be hosted by Uganda, these are mostly former, from what I understand, former Afghan government officials and people who've been closely working with the US government. So this is a different class of refugees, and from what we understand, they'll be hosted in hotels rather than refugee camps. Is that what you're hearing?
It's very early right now to start stating exactly where they're going to be. 2,000 of them are going to arrive, and I know that the Ugandan government has the amenities in place to be able to host them. Yes, they might be hosted in hotels. Remember, we are also in the COVID period, and a number of these hotels have also been designated to host immigrants that are coming into the country for their quarantine time. So there are facilities that are available. They might just need to be converted quickly for a short term. Again, it is our understanding that they're going to be there for the next 90 days. Things might change over the time, but I think Uganda has the capabilities right now, given what they've done and their preparation for the COVID exercise, to be able to host 2,000, 4,000 more people.
Yeah, but do we know how this came about? Because, I mean, it just emerged a couple of days ago that Uganda had sort of stepped into the breach. I mean, is this at the request of the Americans, or did Uganda offer to step in?
Yes, of course, you know, the diplomatic channels instantly went into role as soon as things broke, and Uganda was reached to through the U.S. Embassy and the diplomatic channels that exist. And His Excellency, the President of Uganda, Yoweri Museveni, was very gracious to accept. There are a number of other countries that the same request was made to, and these people will be going to some of these other countries. But yes, this went through diplomatic channels as best as I hear now. And it was through those channels, the embassy in Uganda and State Department that this request was made and accepted.
So I suppose the crucial question, because I mean, you know, let's face it, Uganda is a developing country. I mean, it's an a sub-Saharan African country, and it raises the question of who is going to pay for this. I mean, I've heard suggestions that the American government is going to cover the costs. So these people will be put up at the expense of the US government. Is that right?
At this time, I cannot confirm those allegations, but I know that the country has got a number of stakeholders and very willing development partners that would certainly be glad to join with the government to support this effort.
Just tell us more about your assessment of what is happening in Afghanistan and what the implications are likely to be for a country like Uganda taking in 2,000 refugees.
The situation in Afghanistan, I don't think much more can be said about it. We see what is going on there. It's very sad. Should never have happened. But in the case of Uganda taking in more refugees, that is going to be able to happen. As I said earlier on, they have the capabilities to do that. I think the issue actually is the time at which the refugees are coming in. This is a period, we're still in the pandemic times, and so we have people who are getting on the plane who have not been COVID tested. And so in terms of Uganda, the healthcare system is going to be tested again even more now. Because they have to set up testing amenities to receive these people, quarantine, separation of the people, depending on how the test, so that there is no additional spread of a new variant of the virus in the country. Or Uganda has done a phenomenal job at trying to maintain the pandemic, and this certainly could be the beginning of a new wave. And so the ministries of health and the other development partners in the healthcare space would have to come to gear immediately and start figuring out how this is going to be managed. I think that's going to be the bigger problem in terms of hosting the refugees.
And just moving away slightly from Afghanistan, if you might permit me to take a bit of a liberty. I was looking at your CV and your credentials there. I mean, you're originally from Cameroon, but you've done a lot of work in Uganda, you've done a lot of work in Kenya, you live in the United States, and you are a visiting professor at Ahmadu Bello University in Nigeria. I mean, that's quite a sort of broad, stretch, if you ask me. Tell us more about what you actually do at these various places.
And you missed the more interesting part. I'm actually born in Kenya. So I am Kenyan some days of the week. But what we do, I work for the Global Healthcare Public Foundation. And what we do is we go around and we are strengthening diagnostic medicine in a lot of the countries, well over 16, 17 countries that we work in at the moment. This is just to ensure the fact that all diagnostic tests that are made on humans, in vitro testing, actually delivers the expected results. You may or may not know 66% of the death that occurs on the African continent occurs because of wrong diagnostics. This is laboratory error. And so what the Global Healthcare Public Foundation is doing on the African continent, we're doing a lot of training of the healthcare professionals, the clinical professionals, to be able to do proper diagnostics with the services that they have, not to expect anything to come from somewhere else, but with what they have. And we've been able to make some very strong gains in a lot of countries. In Uganda, for example, where we currently are as of now, we have improved the reliability and the turnaround time for well over another 5 million people have direct access to more reliable health. The healthcare has always been a question. It's always been a challenge. And that's what at the Global Healthcare Public Foundation we do today on the African continent.
Okay, Professor Kilian Songwe, a true African as well as an international consultant. I want to thank you very much indeed for joining us today, and he was with us there from the United States.